All right, let's get right into it. For a long time now, doctors have been prescribing antidepressants for something you might not expect, chronic pain. But here's the big question. Does this actually work? Well, today we're going to crack open a massive scientific review that looked at decades of research to find a clear answer.
I mean, seriously, what if the pain just doesn't stop? For so many people, this isn't a hypothetical. It's their daily reality. We're talking about chronic pain, and that's any pain that hangs around for more than 3 months. It's the kind of thing that can really mess with your mood, your work, your life, pretty much everything.
And this is not some rare condition. The numbers are just, wow. More than a third of people across the entire planet deal with chronic pain. That's a huge reason why finding treatments that actually work is one of the biggest challenges in medicine today.
So to get to the bottom of all this, here's our game plan. We'll start with the problem itself, look at this kind of surprising treatment, and then follow the scientists on their search for answers. We'll see if a clear winner popped out from the data, cover the really important unanswered questions, and finally, talk about what this all means for you.
Okay, so let's start with that surprising treatment. It feels a little strange, right? Using a drug that was designed for your mind to treat a problem in your body. So why? Why do doctors do this?
Well, the theory behind it is actually pretty fascinating. The idea is that the very same chemical signals in our brain that influence our mood might, just might, also be involved in how we perceive pain. It's almost like finding out a single light switch in your house controls the lights in 2 completely different rooms.
But with so many different antidepressants out there, scientists really needed a solid, definitive answer. And in medicine, when you want the most trustworthy, definitive answer, you go to a Cochrane review. They're pretty much the gold standard for pulling all the evidence together to see what's really going on.
You can think of what they did as the ultimate scientific detective work. They used this really powerful technique called a network meta-analysis. It's cool because it lets you compare all the drugs against each other, even if they were never directly tested head-to-head in a study. It's all about piecing together clues from different cases to solve the big one. And the scale of this investigation was just massive. They weren't looking at just a handful of studies. No, they pulled together evidence from 176 different high-quality trials. And in those studies, we're talking about the data from nearly 30,000 people. That is a huge amount of information, which gives their findings some serious weight.
And our scientific detectives weren't just looking at 1 or 2 options. They had a long list of suspects. 25 different antidepressants were all put under the microscope to see how they performed for things like fibromyalgia, nerve pain, and back pain.
So, after all that detective work, after combing through mountains and mountains of data, did they solve the case? You bet they did. The evidence led them to a pretty clear conclusion.
This really is the million-dollar question, isn't it? With more than 24 options on the table, did any of them actually prove to be effective for helping with chronic pain?
So here's what they found. For most of those antidepressants, the evidence was just, well, it was kind of weak. It was too uncertain to say for sure. But for one of them, the signal was strong. It was clear.
And that one drug is called duloxetine. This is the one antidepressant that the researchers could say, with a good amount of confidence, actually helps reduce chronic pain. It was the one that consistently came out on top.
And this chart really shows you what that means in the real world. So, if you take 1,000 people and give them a placebo, a sugar pill, about 287 of them will say their pain was cut in half. That's the placebo effect. But if you give 1,000 people a standard dose of duloxetine, that number jumps all the way up to 435. That's a real significant effect.
And this is so important. Turns out, more is not better. The review found that a standard 60 milligram dose worked, but bumping up the dose, it didn't provide any extra pain relief. And that's absolutely critical info for balancing the benefits with any potential side effects.
Now, duloxetine wasn't completely alone on the podium. There was a runner-up called milnacipran. It also seemed to help with pain, but the evidence just wasn't as strong. It was based on fewer studies with fewer people. So it's promising, for sure, but it needs more research.
But, like with any good investigation, finding an answer often uncovers a whole bunch of new questions. And being honest about what we don't know is just as important as celebrating what we do.
And there are some pretty big gaps here. First, most of these studies were short, averaging about 10 weeks. So we have no idea about long-term effects. Second, the information on safety and side effects was, frankly, not great. So we can't draw any firm conclusions there. Third, and this is a big one, most studies kicked out people who also had depression. So we don't know how well these drugs work for the many people who have both. And finally, for those other 23 drugs, the jury is still very much out.
Okay, so after all of that, what does this actually mean for you? The whole point is to take this complex science and turn it into something useful, something you can bring into a real conversation.
So let's boil it down. 1, we know that duloxetine, at that standard dose, has the strongest evidence on its side right now. 2, this knowledge is a tool. It's something you can use to have a more informed, productive chat with your doctor. And 3, and this is probably the most important takeaway of all, evidence is just one piece of the puzzle.
And I think the researchers themselves put it perfectly here. The evidence can be a guide, but it can't be a dictator. Pain is a deeply, deeply personal thing, and the right treatment plan has to be built around the individual person, not just the data.
So let's do a quick flyover of our journey. We started with this huge global problem of chronic pain. We asked if antidepressants might be an answer. We followed a massive scientific search through 176 studies, and we found that duloxetine has the best evidence. But we have to remember those big caveats about long-term use and safety.
And that leaves us with this final, really important question to think about. This amazing review gives us the best evidence we've ever had, but it also shines a bright light on the challenge ahead. It's not just about finding what works for a big group of people. It's about figuring out what's going to work best for the one unique person right in front of you. And that is the future of pain management.